My name is Elke Leunens. I work at the Faculty of Medicine of KU Leuven, and there I'm International Relations Officer. We have a lot of questions from students who would very much like to do a clinical elective abroad, and my example in the United States, but it's not that easy to do so. There are a lot of requirements, there are a lot of things to know, there's a lot of preparation. First of all, an important remark is that I will talk about an elective which is recognized as part of their curriculum, as their medical curriculum. Because of course everybody can go to the United States and do something voluntarily, but we have in the 6th year of our program some final attainment levels who must be obtained. So if they don't obtain them, they have a fail for their elective, which of course is not the issue here. So they need to come to the Faculty of Medicine and they need to ask me or my colleague what are the requirements of KU Leuven, to which universities can they go, and what is the meaning of this elective just before they start, because otherwise you can come into this situation where you do all this preparation and we say, no, that's not possible, because this won't be recognized. Of course, this is not nice for the students. But if students want to go to the United States for a clinical elective, it is possible. But they have to prepare very well and they have to be on time with it. If you only start preparing like a year in advance, it's much too late. So you should start thinking about it many years in advance, because you have to prepare your language. You have to speak in English all day. So of course it's very important that you have to speak with these patients in English and perfectly or almost perfectly. So you have to make sure you can do that. And in most American schools or American hospitals, it's necessary that you have this language proficiency test, like the TOEFL test or something like that. And therefore, you should prepare as well, so that you can pass the test and you can go there. We also have at the Faculty of Medicine some requirements about language. So students should follow also a course of medical English at the University of Leuven. But that's something else. That's not a requirement of the American hospitals or the American schools, but it is a requirement of KU Leuven, because we only want to send students who know the language, which we are sure of. So that's one thing. So they have to prepare in time and they have to look into all the information that there is. They have to look at the websites of the possible host institutions. They have to come to me. They have to look at our website. They have to contact other students. We have some students who were in the United States. We had a student, for example, who was in Mount Sinai some years ago. He can give a lot of information to the students, and we also have information from him. So from these things they can learn if they want to go there. It's very important. And it's also, of course, important that they look at all the websites, that they see which requirements they need to fulfill. Of course, they also have to look at all the websites of these requirements, like, for example, if they have to take USMLE Step 1 tests, then they have to know what they should do in order to take the test and to pass the test, or the same for the TOEFL test. So that's also very important. They also have to make sure that they check all their insurances, because a lot of medical schools won't accept a student who's not well insured. Of course, we at KU Leuven, we have insurances for the students, but that's restricted. It's not, we don't cover everything, so the rest they have to cover themselves. So that's one thing. And of course, they have to check their indemnity form and make sure that they have all necessary indemnity checks they need, because otherwise they won't make any chance, I think. They also have to study very well. We only want to send the best students abroad, especially also to the United States. So that's very important, not only for us, of course, only I think all American schools and American hospitals will accept students who have a very good curriculum. And they have to pass, for most institutions, they have to pass Step 1 of USMLE. And therefore they have to be well trained and they have to know a lot. So it's very important from the first day you start studying, you study very well. It is important. It sounds very boring, but it is. It's just the way it works. So one other thing which is quite important is that if you want to study abroad, it can be very expensive. Especially if you if you think about all the expenses you have to make when you have to pass some tests. For example, step 1 of USMLE, it's like I think about $1,000, something like that. So that's expensive, and the TOEFL test is also you also have to pay for that. But most medical schools also ask an application fee just to make the application. So, and then if you have paid all of that, you're not even there yet. So it is very expensive, and therefore, if you don't have a lot of financial reserves at home, it's important that, for example, you do like this job during the summer, stuff like that, just to make sure that you won't get in any problems. And I think the most important thing for students is that they have to connect to each other, to other doctors, to professors, and they have to build a whole network of people who would be able to recommend them, that they have some references. If you don't know any people, you can always, at the beginning of your studies, start by looking for voluntarily do something in some hospitals, to get to know some people, to make sure that people see that you're very motivated, that you really want to do something, and maybe there's a doctor who knows somebody, who knows somebody, who knows somebody, and then you can build a network of people who can support you if you finally want to go to the United States. And then maybe there's, oh, I did this this hospital work some years ago, and I know this doctor, and maybe he knows someone. So that's, I think, the way it works, and it's quite important that you do that in advance. And last of all, I think it's very, very important to stay motivated. There will be a lot of medical schools who will say that it's just not possible to come for an elective. So make sure that you keep up the good spirits and that you just keep on trying, and that you can explain to everybody that you're so motivated. You can be ambitious. It's not at all a bad thing to be ambitious. So if you can explain that and tell people that you really want to come and you keep up the good spirit, then I think you're on the right way.